Good morning and welcome back to the Humble Healer podcast. Thanks for joining me today for this episode. This is a perennial endemic disease in New England area. It's a Lyme disease. It was named after a town in Connecticut called Lyme since it's so prevalent in this area. And most of the healthcare clinicians have encountered Lyme disease presentation in patients in one form or others. But there's still other information that I think may be helpful for our community to know about Lyme disease and the treatment options, as well as how to diagnose it from a patient perspective, and also how to prevent. It's a disease that essentially carried out by tick, and this tick carries bacteria, and you don't need to know the name, but the medical name is Borrelia burgdorferi, and it's the most common form of bacteria in the tick-borne illnesses. And Lyme is not the only disease that these tick-borne bacteria can spread. It can cause other diseases too, which have some similar features to Lyme disease, but we do not have to talk about those since they are not as common as Lyme disease. And this is considered endemic in the northeastern North of America. And there are 3 clinical stages in the Lyme disease, and that's why it sometimes can be difficult to diagnose the different clinical symptoms of this disease. The first one is they call early localized disease with the rash. And I will put a picture up for the rash. And I just want my community to understand the difference between common localized inflammatory reaction after you got bit by a tick, which is very small, usually the size of a nickel with a small redness, but some mild pain and tenderness too, versus these big rash that could be up to 10 to 15 centimeter, which is about 4 to 6 inches. And these big rash, they are unique. So once you see them, there is little doubt about anything else that may be causing this disease. And usually they are only one lesion. I have seen several of these cases with the rash, and I rarely ever saw a case where there were 2 of these, what we call a bullseye rash, or the medical term is erythema migrans. And some of them can be very classic looking, that look like a bullseye. Or you think about the symbol of the department store or Target, like a bullseye, but it's big. But sometimes it's not that obvious. Sometimes it's just a whole patch that look kind of purplish, and it's very big, 4-6 inches in diameter. Or sometimes there's no red center. Either way, if you see those giant and painless, they're not painful or itchy. They just look impressive, but there's no itchiness or burning or pain associated with that. Then that's basically is a giant clue for Lyme disease. And from our perspective, as your treating clinician, every time we see you in a healthcare setting, that is Lyme disease until proven otherwise. And that should be an indication to treat patients with a class 10 days of the most popular Lyme or the top line treatment for Lyme disease, the doxycycline. Usually we go between 10 to 21 days, depending on severity of symptoms of patients and immuno status of the patients. So these rashes are big clues, but there are also other signs and symptoms. Sometimes I've seen patients, a lot of times actually, presenting with flu-like symptoms such as fever, chills, body aches, headaches, and sometimes the headache can be pretty significant, and it can last for weeks, sometimes even more than a month or 2, which is very debilitating. And all the testing, other than the Lyme testing, have been negative. So you have to think about either Lyme or other tick-borne illnesses. But if you see patients, if you as a patient too, these prolonged flu-like symptoms such as fever, headaches, body aches, even without a rash, chills, malaise, sometimes nausea, and sometimes even dizziness and minor stroke symptoms sometimes with, no evidence of any other infections, then you have to think about Lyme disease too. And for my rule, when I see patients presenting with the symptoms and we have no evidence of any other infections and they last more than a week, I would start either check for Lyme disease or just treat them because the risk uh, is outweighed by the benefits of patient doing better with a course of doxycycline. And the rash, back to the rash here, they usually occur within a month following a tick bite. So another important point I want to point out is that most of the time you don't even remember when the tick bite happened because it can be very difficult to notice. And most patients that actually were diagnosed with Lyme disease in clinical settings, they did not recall being bitten by a tick. So I never use that as an important piece of history when patients told me that, oh, I don't remember being bitten. That doesn't really change how I approach my diagnostic testings. And then, so those are early localized disease. And then you have early disseminated disease, which is rare when like I said, multiple lesions. And then now you start seeing neurologic findings such as meningitis, headache, neck stiffness, sometimes dizziness, vomiting. And then you start seeing the other neurological signs, sometimes with, Bell's palsy, which is a very not uncommon manifestation of Lyme disease where you have one-sided weakness. And it's tricky because sometimes it can mimic stroke symptoms. And when you show up at a place like the urgent care emergency department, our job is to be able to tell the difference, which sometimes not that obvious. And also, you can get some sensory symptoms such as numbness, tingling, and so on. And then also heart block, which I have seen before, completely healthy patient with no heart history and came in with heart rate down into the 40s. Sometimes that can cause enough problem with fatigue and malaise and so on. And I've seen it in my family members that live next to a woods where his heart rate went down to the 30s at nighttime. And it was thought to be secondary to Lyme disease by the treating cardiologist. And then it also can cause myopericarditis, where you have inflammation of the linings of the heart, sometimes severe enough to cause problem and affect how your heart can function. That can be diagnosed sometimes when they take the fluid out of the outer layer of the heart to diagnose it. So it can cause some serious problems. And I also remember a case of encephalitis in an elderly gentleman in his 70s where he came in with um, over a month of dizziness, some trouble with walking where he was a little bit off, and then headache and malaise. It's just some vague neurological symptoms with no evidence of any other disease, and he ended up having Lyme disease. So it can be when you see these symptoms and they last for a bit, several weeks, then start thinking about Lyme disease and getting tested and go get medical treatment. Also, another not uncommon clinical manifestation of Lyme is arthritis. So if you have joint swelling for no reason, no trauma, no gout, and sometimes it swells up. Probably the most common joint is the knee, and then it goes away and then it comes back again, and no other explanation, and it can go on for months. Then we need to get tested for Lyme disease also. And the treatment for Lyme arthritis is longer, usually 21 days, not like a typical 10 days like other Lyme clinical presentation. So that is a clinical presentation for Lyme disease. It can be tricky, but something to be aware of, especially living in the endemic area of Lyme disease. Multiple possible manifestations, especially the rash, which I will put on a few pictures for you to view. They're very distinct and easy to remember. For diagnosis, the rash is important, and then the history of long-lasting flu-like symptoms, more than a week, more than 10 days, without any other evidence of any infections. And then also you can do blood tests to confirm, to find the antibodies to Lyme, and they have IgG and IgMs. Just remember that just because you have a positive test doesn't mean that you have an acute or active infection. Sometimes it could be from years ago and you just had a mild illness that was not detected. And now when you check for the antibodies, you found only IgG, immunoglobulin G, and that means that it's an old infection. But if we do find IgM, then that means that you do have an acute infection, and that is an indication for treatment. If not already, IgM is acute. DGs is an old infection. Please keep that in mind. And then sometimes we also get back what we call PCR, where we test for the presence of the Lyme proteins. That also is an indication for treatment, and that's probably is a better test, but it's not very sensitive, so you don't always see that. And let me see for management. So sometimes when patients come in with, say, they say they have a tick bite, and they don't know how long the tick has been there, especially if the tick looks really big, engorged. They look like a kernel, then it's more likely to be at a higher risk for transmitting the Lyme bacteria to the body, to your own system. They did studies and they found that it takes an average of 54 hours for a tick to transmit the bacteria from their gut to our system. So if you took a walk in the woods and the next day you notice that you got a tick on, then it's less likely to be at risk. And most of the time, I just told patients to just watch out. Don't worry about it. Because if you do take daily showers and you discover ticks on your body, then it's unlikely to be on your body for over 24 hours. That makes it much less likely to catch the Lyme bacteria. Also, the ticks, 50%, only 50% of ticks carry the Lyme bacteria, which is pretty high percentage, but it's not 100%. So that makes it less likely to transmit the Lyme bacteria. Also, if patients present with history of hunting or outdoor camping a week long and without any shower access, then that may be more suspicious for catching the Lyme bacteria, since you don't get to check your own body to see, and you're in a really high risk environment in nature that where basically ticks feast on campers and hunters. Sometimes they could latch on and stay on for days. So those are high risk patients. And in high risk patients, there is a treatment to prevent development of Lyme disease, whereas you can get 2 tablets of doxycycline, and it's pretty effective in preventing Lyme disease. Make sure that you take that with food, since cycline can be irritating to your stomach lining. So ask someone or a PCP's office and so on to see whether you can get that Lyme prophylaxis. But as far as I'm concerned, in the clinical setting, patients are very anxious about developing Lyme disease from a tick bite, and they ask me for help, even though it's low risk. Sometimes I prescribe the medication anyways to help give the patient peace of mind, because if not for anything, it can really relieve a lot of anxiety feelings by the patients. So it's worth giving the 2 capsules or 2 tablets of doxycycline to take one time to prevent development of Lyme disease. And for those that cannot tolerate doxycycline, slightly less effective could be amoxicillin, a class of antibiotic called cephalosporin. It's a second generation cephalosporin called cefuroxime, which has been found to be also effective against Lyme disease. And in a lot of patients with history of penicillin or amoxicillin without life-threatening allergic reaction, they can tolerate cefuroxime just fine, over 95% of the time. And then in severe or in systemic Lyme disease, the treatment based on the severity of symptoms, and in rare cases, patients need to be admitted to the hospital for intravenous antibiotic treatment and close follow-up with most likely an infectious disease specialist following to ensure clinical improvement. And those are in severe cases like Lyme meningitis or Lyme bacteremia, sepsis, and so on. Also, myopericarditis, as mentioned earlier. Sometimes patients can develop a massive inflammatory reactions due to when they were started on an antibiotic. And you don't need to memorize this. It's called Jarisch-Hersheimer reaction. And that can also be pretty severe, causing worsening of symptoms in the beginning after treatment. And then this gets better, but you have to watch out for more serious adverse effects from this treatment. And then a lot of people talk about chronic Lyme disease or post-Lyme disease syndrome. Most healthcare professionals do not believe in this, and it's certainly a controversial topic. And a lot of patients who had chronic clinical syndromes not explained by anything else. Sometimes they need an explanation. So they said they use chronic Lyme disease as their disease that was causing their chronic symptoms. There was a study where patient with these chronic post-Lyme syndrome, and they gave this patient treatment with intravenous ceftriaxone, which is a very good antibiotic for Lyme disease, and they gave them daily for 6 months, which can be also harmful in its own way, wreaking havoc on your what we call microflora in your system, and can also create a lot of long-term adverse effects. In any case, the outcome did not show any difference in terms of clinical improvement for these patients versus those who just got placebo treatment, which has no medicine in it. So 6 months of an intravenous antibiotics did not make a difference, did not help. So we have to be careful about presuming chronic Lyme disease as an explanation for our chronic symptoms such as chronic fatigue or chronic joint pain or malaise and so on. I wouldn't be too quick to conclude that this is a chronic Lyme disease, even when you have history of Lyme disease in the past. So let's talk about prevention for Lyme disease. So to prevent Lyme disease, best to prevent tick bite. Use personal protection and prevention on high-risk activities. So if you go to outdoor camping, make sure you bring repellent containing DEET, DEET, icaridin, or IR 3535, or eucalyptus oil to expose skin. And then also treat the gear or clothing using 0.5% permethrin on clothing, boots, and camping gear. And it does remain effective through multiple washings. And also wear protective clothing and wear long sleeve shirts and long pants tucked into socks to prevent tick from reaching your skin. And if possible, check and shower if you have access, and conduct a full body tick checks after being in a wooded or grassy area, and focusing on the underarms, behind the knees, and in your hair, which is going to be a challenge if you have long, thick hair. Showering within 2 hours of coming indoors help wash off the unattached ticks. And dry clothes. Put dry clothing in a dry or high heat for 10 minutes to kill ticks. Can be helpful. Environmental control can also help. Landscape management, including keeping your lawns mowed, your brush clear, and your leaves raked. Because the ticks, they love hang on any sort of tall grasses or bush. And then when you take a walk in the woods or in your lawn, they jump and latch right onto you. And also create barriers, like use wood chip or gravel to create a 3-foot wide barrier between lawns and wooded area to restrict tick migration. And also control pets. Use tick control products on pets as it can carry ticks into your home. And if a tick is found, use fine tip tweezers to rasp to close to the skin and pull upward with steady pressure. The most successful technique that I use at the urgent care clinic that I work on, primary care clinic, is you use the clockwise or counterclockwise. Turn this way, nice and slow, steady with a pair of tweezers, and just turn slowly this way, and then reverse this way, just nice and slow. I think it has a lot better success than pull straight out, which can remove the body of the tick, but then leave the tick legs behind under your skin. And it's not a huge deal. I mean, you just have to dig it out, because even though there's no evidence that tick legs remain in your skin can cause any problem, but nobody likes to have any remain tick body part in their body. So you just have to sometimes even numb the area, cut it out, and then just cover with antibiotic and Band-Aid, and that's the end of it. But if you use the clockwise and counterclockwise method with steady pressure, that will give you the most success at home. Don't use fire, don't use any ice. There's no really evidence of anything that works other than just using that technique that I talked about, and that you can create more problems if you do things that are not recommended. And then after tick bite, watch out for symptoms. If you have no symptoms, then there's nothing to worry about, unless you want to get preventive treatment, then call your primary care provider and also or go to an urgent care clinic and ask for two tablets of doxycycline. But if you start having flu-like symptoms, especially lasting more than a week, fever, body aches, and the rash that we talked about, malaise, terrible headache too, joint pain, things like that, just come in and get checked out. So I hope you find this episode helpful about Lyme disease and also how to recognize it and when to seek treatment and what to do when you find a tick latch on to your body. Let me know if you have any questions, comments, and hopefully you share this with your family and friends so that we can go through this spring season tick free and Lyme free. Thank you and take care, everyone.